Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. This is your weekly minisode where we'll provide a brief update on local public health news. So, Tom, what's up in public health this week?
Today, we have Heather Reider, coordinator for the Avian Health Program at CSU, here to talk about recent cases of avian flu in northern Colorado. Heather, thank you so much for joining us.
Yeah, thank you so much for having me.
So first off, can you explain what highly pathogenic avian flu is for us?
Yeah, for sure. So highly pathogenic avian influenza it actually is a term that we use with poultry, because when it gets into poultry, it's very severe, it's fast moving, it causes a lot of mortality and loss within poultry. And the current strain that's circulating is the H5N1. So a lot of people probably within the news and the media have heard it called bird flu, HPAI, H5N1, and that's all kind of referring to the same kind of strain that's circulating right now, the strain of concern. There's always other flus out there, but this is the one that's kind of causing a lot of havoc in commercial and backyard flocks.
So why is HPAI important? And why are you guys paying attention to it so closely?
This particular strain, especially, like I already kind of mentioned, it really moves fast and it kind of can kill a lot of birds really quickly, like when it gets into a flock. We've also seen kind of major economic impact in the food supply chain, right? We kind of can all think back probably over a year ago when you're going to the market and there's not as many egg options on the shelf and the prices have gone up. So sometimes that's what's affecting the consumer directly. But for us too, because it does get into commercial and backyard flocks and just that huge loss of birds, I think in the U.S. total, we've lost close to 184, I think we're getting up there towards 190 million birds lost. In Colorado alone, since the outbreak, we've lost over 11 million birds.
Wow.
So, and two, there's always this zoonotic potential. And when we say zoonotic, we mean there's a risk to spill over into humans, right? And we want to prevent that from happening.
That raises, another question. How is this disease commonly transmitted?
This particular one is a wild bird transmitted disease. So really what you're seeing is when you, probably a lot of the public now at this point has seen the dead and dying geese when they're taking walks through the park. And so we're all kind of familiar with that. But they are the spreader of the disease, and they're kind of what we consider the natural reservoir of this disease. And so they're spreading it through their bird droppings, through respiratory means. The best way I've kind of heard it described, we can all probably picture what goose poop looks at this point. We've all walked through it. It's everywhere. But if you think about that, if you've got an infected bird and you've got an infected goose poop, right, it has enough viral load to affect over 1 million birds. So that's how much virus is kind of being put out by geese. And we can all think right now they're all congregating, they're all together, they're kind of eating, and they're in the water systems. And if you've got a backyard flock, you're especially high risk around this, just given how much viral load can come out of these birds.
Wow. So what does the avian influenza situation look like then in northern Colorado?
So we always are monitoring what's happening in the wild bird population. And we've seen an uptick in positive cases in wild birds. And that correlates with what we're seeing in our commercial flocks and in our backyard flocks. So we've had a lot more positive cases recently. In the last 30 days in Colorado, I think we're somewhere between 4 or 5 backyard flocks that we've had positive detections in. And then, of course, in Weld County, we had a commercial facility that we had a positive detection in. And so many people don't know this about Colorado, but we are a table egg layer state. We range between 17th and 20 in the nation for table egg layers. Yeah, so I might have already mentioned it, but we've already in Colorado, since this outbreak, lost close to 11 million birds in Colorado alone.
Wow. So what does detection look like then for avian flu?
Yeah, for sure. So a lot of times the number one sign that we're seeing in a poultry flock, so that can be turkeys, game birds, chickens, is we just get high mortality. That's the most common sign that we see. We get a call that over the last few days, I've lost, quite a number of birds, is usually what we hear. And then when we kind of hear that, we'll work with that owner to get their birds tested. So it's just an oral pharyngeal swab we collect. We get that into our lab. We run that test. And then once we have the results, that'll kind of determine what we do next.
Gotcha. So what does a typical outbreak response then look like?
Yeah, so if we get a positive flock, and it's going to depend, right? So we'll talk backyard flocks for a moment. If we get it in a backyard flock, usually a backyard flock, depending on kind of what they do with their birds, kind of has an option. They can usually, quarantining is always a part of that equation, but sometimes you can quarantine and just kind of let the virus take its toll on your birds, or we can help you depopulate. Most people do opt to depopulate just because it is so incredibly hard on the birds, and it is so fast moving, and it causes such high mortality that watching the birds suffer is very hard. So we work really closely with them to make sure that they, we help them along every step along the way.
Yeah, right. So you've mentioned that this primarily it's impacted larger facilities and also smaller backyard flocks. What can folks who have smaller backyard flocks do to help protect their birds?
So, it's always, we've already talked about transmission. So understanding the risks to your flock is really important. So do you live in an area where there's fields or ponds where you're going to have a lot of waterfowl? That's going to put you into a higher risk category. We've had cases where someone in the family, for instance, is a duck hunter, and it's come back through duck hunting or waterfowl hunting, and they brought it home that way. They didn't clean and disinfect their gear and their clothing, and they brought it into their flock. We've had cases, there is spillover events into other animals, like peridomestic animals, like raccoons, skunks, for instance. And so we've had where we had a detection where we had a sick skunk, and we tested it, and the skunk was positive for flu. And it wasn't long after that the flock also was positive for flu. So it's a good chance that that's how that got in. And then also little birds. Birds are always a high risk. So just trying to keep your birds indoors and away from wildlife is the biggest thing you can do right now, especially if you've got a lot of waterfowl. There's a couple flocks, too, we've worked where unfortunately, they got bird flu, and there was a water ditch kind of on their premises, and right on the other side of that gate was a bunch of ducks, right? So just the fact that they're just in the vicinity of these wild birds puts them at risk.
Wow. So what are some signs or symptoms that a bird has avian flu?
Yeah, like I said, the number one is high mortality. So that's the most common. Sometimes you'll see some neurologic signs before you get the mortality. You can see some pacing, some the bird's not acting right, kind of ataxic. There are some other symptoms we can see, sometimes swollen wattles, but I would say with this particular strain, the most common sign we see is just a lot of birds dying in a very short window of time. It's very hard.
Man, that's got to be hard. So you'd already mentioned this a little bit previously that, there have been transmissions to skunks. Are there other kinds of animals that have the potential to get avian flu then?
Yeah, we've seen, actually, if you go USDA website, and if you actually search USDA or HPAI, you'll go right to their website, and they have a list there where you can look at what's happening in the poultry industry, what's happening with wildlife and other domestic species, so cats are high risk. We've had lots of spillover events into wildlife, anything from mountain lions. We've had it in dolphins, but then the peridomestic like skunk, are some of the more common cases that you're usually consuming, like a dead goose. These usually had to consume it's the carnivores are the ones that are scavenging on the dead geese. Other raptors have been hit exceptionally hard, like vultures and owls and eagles and hawks and stuff like that. So we have had a lot of spillover into other species. And then the biggest one was in cattle. So we had kind of a spillover into cattle recently that we've been kind of managing. So which is a unique one.
So I guess that begs the question, are humans at risk for avian flu?
We do have these spillover events. What we're not having is human-to-human transmission. But when we do have human cases, it's usually they've come in direct contact with a positive flock, cattle workers, someone that's actually working in the environment where flu is present. So it's still really low risk to humans, but it does happen. We do see cases in humans, and I think in the U.S. we've had one death, but the CDC website kind of keeps that up to date.
And what do symptoms then look like when a human gets the avian flu?
I'm not a human expert, but my understanding is you'll see conjunctivitis and some other kind of flu-like symptoms.
Gotcha. So I guess another follow-up question to that is, do we need to worry about, eating eggs or meat?
If you handle and cook your food properly, right? So like that's the one thing about flu is at any heat. So like in the summertime, especially when you don't have as much migration, in the environment because it's so hot, it does, the virus can actually disappear quickly in the environment. But in these colder temperatures, like right now, the virus does pretty well. And of course, we've got spring and fall where the temperatures are cooler, so the virus stays around in the environment a lot longer. So that does translate over to food too, right? And that's for any poultry diseases like Salmonella, Campylobacteria, E. coli, right? You want to cook your food to temperature. You don't want to eat raw food or undercooked poultry or even raw milk with the cattle cases. That's a kind of another risk. And especially with like cats, this is what we've seen when it gets into domestic cats. A lot of times it's through one of those pathways, like cats on raw food diets, with a contaminated meat or raw milk. Maybe cats that work in the dairy, that's where we first kind of saw it because they're drinking the raw milk.
Oh.
Yeah, and so really you want to make sure, even for your pets, that you're cooking the food to temperature, not eating raw food, and that does a pretty good job of inactivating it. But also in these commercial facilities, none of the food, like the eggs and stuff at these commercial facilities, is entering the supply chain. So if we get flu cases, that's all destroyed.
Gotcha. So if people are out in the community and they do see like a group of dead birds, what should they do?
Yeah, so if it's wildlife, Colorado Parks and Wildlife is, they always encourage you to call them. Doesn't mean they always have the capacity to respond, but they do like to be made aware of what's happening, and that leaves the choice kind of how they manage it. We do not recommend people necessarily, picking up animals, right? Stay clear of them. But sometimes there are circumstances where maybe it's in an area where there's a lot of animal or human traffic and they really want to get rid of it. And so what we recommend is obviously wear gloves, making sure you wash your hands before and after, wear a face mask, wear eye protection, and then you double bag the bird in like a trash bag and then spray the exterior with like a disinfectant. Like a household Lysol will work just fine. And then you can dispose of it in the normal trash stream. So if that's something you have to do, then that's kind of the best safe way to do it. But making sure you're not touching your face and your phone and things that you can contaminate with, that you're able to kind of wash your hands and stuff afterwards and wear gloves. And you can always call us too, like give us a call. And not that we can always fix it, but we can point people at resources.
Yeah, which comes to my next question. If people want to learn more about avian flu and the current situation in northern Colorado, where can they go for more information?
Yeah, that's a great question. So there's, like I already mentioned, there's the USDA website. So if you search USDA website and put HPAI in there, you'll go right to their dashboard, which kind of has the cattle, chicken, wildlife dashboards on it. If you want to know what's happening specifically in Colorado, if you go to the Colorado Department of Agriculture website and you put in again HPAI, you'll be taken to their site, which has the latest updates and what's happening in Colorado. So those are two really, really, really good resources.
Gotcha. Is there anything else you think our listeners should know about HPAI?
Yeah, we actually also have a resource. It's slightly different, but it's for small flocks, and it's www.healthybirds.info. And it's a new site out there for small flock owners. It has everything on poultry basics, lots of information on biosecurity. So if you really want to learn more detail about the stuff I was talking about today, it's got great information on there on biosecurity, and it's got really good information on bird diseases too, and just kind of how you can protect your flock. Because I always think of biosecurity, there's no one simple thing you can do, but I always think of biosecurity like an onion. All the different layers that you can add is the best way to keep your flock safe. But again, there's not really a simple one step you can do. It's kind of all the different things that you can do to keep your flock safe.
Gotcha. Well, Heather, thank you so much for joining us, and thanks for all that you do. We really appreciate you taking the time.
Yeah, thank you so much for having me.
Valentine's Day is right around the corner, and it's a great reminder to check in with your sexual and reproductive health. Joining us today to share some guidance and information about the services offered here at our clinic is Meg Vertovec, Senior Nurse Practitioner in our Sexual and Reproductive Health Clinic. Meg, thank you so much for joining us.
Thanks so much for having me. I'm excited to be here.
Sexual and reproductive health is an important part of routine health care this month and every month. What should people remember to think about when it comes to their sexual and reproductive health?
Great question. And I'm glad you brought that up. I think just like we go to the dentist a couple of times a year, our sexual health is an important aspect that we should be considering, and it's easy to forget. And so I think the first thing I always tell our patients is knowledge is power. And so high quality information helps us all make good decisions and informed decisions about our health and otherwise. And so seeing a sexual and reproductive health provider regularly is an opportunity to get that knowledge in a way where you know it's going to be evidence-based, which can be harder to do on your own. I also always like to tell our patients that prevention is 100 times easier than treatment. And so routinely checking in with your health, checking in with your healthcare team will allow you to get preventative care services as needed, and education can be part of prevention. And when we can prevent problems, that is always superior than waiting until those problems arise when we need oftentimes more expensive or difficult treatment. Finally, I always tell our patients that we might have gone to school to help treat and care for them, but they are always going to be the expert of their own body. And so if something just doesn't feel right, you have questions or concerns, there's changes, that's a great time to come in and talk through them with us.
How often should you see a healthcare provider to talk about things like STI testing and birth control?
So that will really come down to individual risks, and everyone's going to be a little bit different. It's great to have that conversation if you're in the practice of seeing a provider annually for an annual physical or preventative care services, and they can help go through step by step your unique situation, any specific risk factors you have, and formulate a plan that is tailored to your needs.
Our clinic here at the health department provides sexual and reproductive health services. What services does our clinic offer?
So we are not a full spectrum primary care clinic, but we do a great job in the avenue where we do work, so sexual and reproductive health. So that includes things like STI testing and STI treatment for a wide variety of STIs. Those are sexually transmitted infections. We also provide on-site a diverse amount of birth control methods. And so that includes things like pills, birth control rings, birth control injections. We also do procedures to place things like intrauterine contraceptive devices, both hormonal and non-hormonal, as well as birth control implants. We also provide emergency contraception. We offer pregnancy testing and counseling about your options. And then we perform regular routine reproductive health exams. So that would include things like cervical cancer screenings or pap smears, as well as vaccines to protect against different sexually transmitted infections.
Sometimes coming in for a sexual and reproductive health appointment can cause some anxiety. What happens during an appointment? What can people expect when they come into our clinic?
I'm so glad you brought this up because I think that's a reason a lot of people delay or avoid care, which is understandable. It can be intimidating to go to any clinic, especially a clinic for sexual and reproductive health. So I always tell our patients that we provide what we call patient-centered care, or care that's really guided by the individual patient and their needs. And so we will talk through with them what they're comfortable with, what they're looking for, what symptoms they're experiencing before we perform any exams or any testing. I always also want patients to know that their consent is essential. And so if there's things that we might recommend based on their risk factors or the stories they're telling us, that doesn't mean that they need to agree to an exam or certain testing. It's always going to be guided by their needs, their desires, and their choices. And so we want them to feel empowered and comfortable seeking care here and know that we're going to work together as a team to figure out what's best for them and for their health. And so oftentimes patients get nervous, specifically about the exam portion. And so I tell patients, things have changed a lot. You don't routinely need an exam if you're not having symptoms. And so if you're interested in starting a birth control method, oftentimes we can talk through all the methods, and you don't even need to have an exam to start things like birth control pills or birth control rings or birth control shots. Also, for testing, if you're not having symptoms that you're concerned or you want us to examine, you can collect your own test swabs, which is really empowering for patients who might be intimidated by having to have that exam. And so I hope that patients can learn that it doesn't have to be such a scary place to come.
Who can use these services? Who can come to our clinic?
So the health department is unique. Our clinic is unique in that we don't accept private insurance at this time. And so we only bill Medicaid, and then the rest of our patients are considered self-pay. That means we're also always happy to see any patients who don't have insurance. All of our patients with private insurance or who don't have insurance will be placed on a sliding fee scale, and that's based on their self-reported income. And we never turn anyone away because of inability to pay. We don't want people to be intimidated to seek services or to delay services because of fear of cost. And so I would encourage them to give us a call, and we can walk through where they would fall on that sliding fee scale. And we always work with patients to get the care they need, regardless of their ability to pay. Also, it's important to know in the state of Colorado, patients of all ages can seek sexual and reproductive health care without parental consent. So we can provide care to minors in our sexual and reproductive health clinic. We always encourage having a trusted adult involved, but not everyone has that. And so we do provide care for patients of all ages that is confidential.
And how can listeners request an appointment?
So patients can call our health department directly at 970-498-6700. They can also go to larimer.gov/health, click on the clinical services page, and there is a spot where you can request an appointment online, and one of our clerical team members will call them back to get that scheduled.
Awesome. Meg, thanks so much for joining us today.
Thank you.
Thanks for listening, Larimer County. Until next week, stay well, stay connected, and remember, we really are healthier together.